Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department, talking to Dr. Kerri Bowie. She is the director, the dental director here at MCHD. How are you?
I'm good. How are you?
I'm great. Now I know you just graduated and you've only been here for a very short while, right?
Correct.
No, you've been here for a long time. You've been here longer than I have. You've been here getting close to your, I'm trying to swallow,
20th
20th
year.
year. That's correct. So I think you know a thing or two about being a dentist, right?
Yes, I hope so.
Yeah, well, I know so. Well, the reason why you're on Wellness Wednesday today is we know that there is a decline of people going to the dentist during COVID. And let's talk about that. Let's try to figure out why people don't want to go to the dentist right now. I know you all haven't changed anything that you're doing. If anything, you've increased all of the procedures that you're doing. I mean, you still wear gloves, that's not optional. You still wear masks and shields, and now you've added an additional N95 mask too. So and I see you've got your button on just like wait, wrong side. My
Oh,
button.
yeah.
We've both been vaccinated for COVID-19.
Yes.
So we are protected.
Yes, dental clinics have always had a very stringent infection control process. So not much has changed with that. We've always been, gowns and masks and gloves and face shields. And of course, we've added the N95 in addition to a surgical mask. We have been very stringent about controlling the aerosols in the operatories. So that was something that was, recommended by the CDC. So, we follow all the guidelines that have been put out. So, like you said, it has been slow people coming back originally after the,
Mhm.
shutdown. Of course, people were pretty fearful about going anywhere, doctor, dentist, unless it was just an absolute emergency. But obviously, we know that, if you don't take care of the routine stuff, then catch yourself in an emergency. So, we definitely want our patients to know and understand that, it's okay to come to the dentist. We're safe, we're protected, we're protecting you, and we definitely want to keep their oral health in check so that they don't end up, with a toothache or having a problem and then have to come in on an emergency basis.
Yeah, that's never good. Now the recommendation is see your dentist every 6 months. That's not a suggestion. That's a recommend
Correct.
that's a recommendation. So, um, proper dental care um, eliminates other health problems. Correct.
Yes, correct.
So,
And we
yeah.
see people come in all the time and they're trying to get a surgery done. They're trying to get a knee replacement. They're trying to get a hip replacement. They're trying to get, things that they need for their other health, and they need to be cleared, in the dental aspect. And then they show up and they have, years worth of neglect that can't be fixed overnight in order for them to get their surgery. So, it's all tied together. You have to have a healthy mouth to go along with your healthy body.
Yeah, I mean that's where food goes, right? So you got to take care of that.
Yes.
So a dental appointment lasts what, 5, 6, 7 hours or something like
Mm,
that?
no, 30 minutes.
Hmm.
We definitely are able to accommodate people. We're not keeping you here all day. You come get a cleaning. If you come back and get fillings or extractions or any work, we
Hmm.
have a job to do. We have a lot of patients to see, so we can't keep you here for several hours. So we do take care of you in a timely manner.
Yeah, I think that's one of the things that people dread is, oh, I have to wait in the waiting room. The waiting room is kind of like a purgatory at most places. So but no, it's not the case like that here. Yeah, you get patients in and out quickly. They don't have to wait. Now they can obviously call to make an appointment, 690
Yes.
8889. That's 251. Make a dental appointment. But that's not just here at our main location. We're also at 5 other locations throughout the county. So can you run down the other locations that we are?
Right. And if they call the 690-8889, they can make an appointment at any of the locations. But we have our clinic here at Keeler. We have a clinic at Sims. We have a clinic in 8 Mile. We have a clinic in Citronelle. We have a clinic on Dolphin Island Parkway. And we have a clinic in Tillman's Corner.
Mhm.
Did I forget any?
No,
I
I
think I
think,
can have them all.
yeah,
And
yeah, I think your
we
point.
do offer Saturday hours at the clinic here in downtown at the Keeler building. We're here from 8 to 12 on Saturdays.
Yeah, conveniently located for sure throughout
Mhm.
the county, north part of the county, south part of the county, east part of the county, west part of the county. We can all sing that song.
Yes.
But Dr. Bowie, I know we talked before Wellness Wednesday, and you said that your patient load is okay for adults, but you're having problems getting kids back in.
Yeah, I have noticed that we've been slower with getting our kids and adolescents back in for treatment, and I think that partially may be due to the fact that typically kids aren't complaining of toothaches or problems or pain, so maybe parents aren't thinking let's rush them back in and get them back in to get their teeth cleaned or checked. But obviously they can still have issues, and they still need cleanings every 6 months, and they still, need to be checked for cavities and have their fillings, done before they cause a problem. But, even though the patients and the schedules have slowly started to increase, I have seen a slower increase in the kids and adolescents as opposed to the adults.
Yeah, and that's really important for kids because they're still growing, their teeth are still developing, they're still developing good eating habits and everything else. So that getting into
Yes.
that routine of every 6 months, and you all can make that appointment. So if someone comes in, you can make a 6 month appointment further in advance to kind of help them. And you also send all kinds of reminders to people too to let them know your appointment's coming up and don't miss it. And why aren't you
Yes.
here? And everything
And,
else. Yeah.
keep in mind if, we have pediatrics here, we have WIC here, we have all other, type of departments and clinics, and, you can coordinate those visits as well. If your child needs a well check and they're coming to have a well check in the pediatric clinic, then, go ahead and schedule them a dental visit after that, and you can kind of knock those out on the same day. So, we can accommodate things like that as well because we have everything you need in one spot.
You are the one-stop shop on the second floor, aren't you?
We try to be.
Well, Dr. Bowie, thank you. Anything else you want to add about dental services?
I don't think so. Just that we're here and we're happy to see everybody. And like I said, we have, like you said, we have clinics. We have availability, so we should have something to fit in your schedule. I know things are crazy with COVID, and people are working, and people are virtual school and in school, and schedules are crazy. But we're here Monday through Friday. We have Saturdays, and we just want everybody to know that it's safe to come back, and it's safe to, have dental work done, and we're taking all the precautions we need, and we're gonna all get through this together.
Yeah. Oh, last thing to add. We do have real dentists. So, we
Mm-hmm.
don't have students or anything like that.
No,
You all have years of experience. We have real dentists here, licensed. It's not anybody that's just practicing to go on to somebody
exactly.
else. So yeah.
Yes.
So that's another reassurance to people to know that we have real medical professionals, real
Yes,
dentists.
we do.
And you've been here long enough to attest to
Yes.
that.
Yes.
Well, Dr. Bowie, thank you for being on Wellness Wednesday.
Oh, you're welcome.